Yeah, the 3D effect, the shades. The name of painting is A Walk in the Garden. When you walk, you're alone. Remember this. How's this painting? What did you like in this? Name of painting is You Are My Galaxy. Sometimes we spend lifetime searching for the one and we never find. We get married, we get into relationship, all this, and still searching for the one. Who is in your life is the one. The person in my life is the one. So you are my galaxy. Don't wait for the one to come. Make the one in your life the one and your galaxy. For a child, what will you say? Like for a partner, you say you are my galaxy. For a child, what will you say? What will be the title? Write down there is a painting for parents and the child, the relationship it depicts. Okay. So this painting depicts relationship between a couple, right? You are my galaxy. So there is a painting which reflects relationship with parent and child. What would be the title of that painting? Right now, my universe. Yeah, well, that's good. My life, my soul. Okay, my soul. That is too much. You beat your child very. Okay, and but no, no, you are my soul. That's why I'm beating you. Very good. Okay. Huh. Oh, and any other? My world. Okay, my world, my universe, my life. Okay, my world. Okay. We want to start this with you. Yeah, we want to share. Say, hey, this painting is for you. Right? So you are my galaxy is for a partner. You are my sun. You are my star is for the child. You are everything. The sun, the star, the moon, everything. Life is revolved around the star, the sun, and the moon. Yeah. If you want to see that painting, continue to attend the classes with video on and smile. Yeah? If you don't have smile on your face, you should off the video. Don't attend like this. Yeah. So keep a pleasant smile if you're showing your face. My joy. That's also good, 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 good. Yeah. Yeah. Last time we learned blood reports, lab reports. Lab reports are of fundamentally 5 or 6 types. The sixth is a marker. So the blood components, the disease or the organ, hormones, right? Markers. So markers may be inflammatory marker, cardiac marker, pancreatic marker, all those. Yeah. Then autoimmune disease, there are markers for that and everything. Then the advanced, we forget that. No? Or that may be for the cancer and all those things. In any blood report, when you see, you should be able to explain to the client what is the meaning of this particular value. Right? If amylase is there, pancreatic amylase, what is the meaning of this? As a nutrition, no one is doing it. Pathologist not doing. Their family doctor not doing. If they come to you with a blood report, if you tell them what is the meaning of this blood report, that creates engagement, that creates a relationship. She will respect you. She will visit you again. She will refer your client. I visited that ma'am. No one ever explained me that blood report so well. She explained my blood report, though it was normal. Yeah? So she's very good. You should go to her. Even if you don't have disease, if you don't want to do nutrition dietetics, you should go to her because Going to her makes you feel good, nice. It gives you knowledge. You want that? So to create that, you should never know the difficult part. Yeah. The values, the formula, which method, which blood test to use, how the blood is collected. Hey, useless thing. You can read it, never actually, because you don't need it. Yeah. Even as a doctor, you don't need that things. What you need is, what is a lab reference report? What is the meaning of that? And what is the patient's value? And whether this value is abnormal or normal. It is given already in that particular report. What is the meaning of normal? What is the meaning of abnormal? What is high? What is low? And when it happens. What to tell the client. Easy? Yeah. So last time we saw CBC, we saw thyroid, and which one we saw last time? Anyone remembers? Yeah, Barkha remembers. Write down. Vitamin D and vitamin B. And we learned the story of the color injections, the pink, yellow, the red injection. Uh, and we learn HbA1c also. Okay. So today we go to the next organ. We do liver and lipid. And if time gives, kidney. Good idea? Start with the liver, or we see which one we find more interesting. Yeah. We also saw ESR, erythrocyte sedimentation rate, that it has no meaning, no conclusive finding. If someone tries to scare you, with that, you should not get scared. Yeah. I will silent my phone, distractions. And we saw how the iron RBCs, right? Microcytic. See, you don't need to remember this word or terminology, microcytic. What is the meaning of this? You should know if there is anemia, it can be because of iron deficiency, which is rare actually in today's population, the food you eat, or it can be vitamin also. It can be zinc, or it can be loss of blood, either excess menstruation or into stools or something, or it can be worm infestation. Very good, Ramya. Hey, this cholesterol and lipid is a big chapter, huh? We will do it along with your cardiac chapter. So what we do, I just opened that and realized I have to talk a lot in that thing. So we will do with funny stories, obviously. So cardiac, stroke, how the risk is found. And we will find risk for each and every one of you. Okay. I will share the formula just for fun. You don't need to remember or use it. And how to calculate what is your risk of dying with a heart disease in next 10 years. You can do it for your family members also. And make sure if someone is about to die, sign their will immediately. Okay, if there is a high risk. So the question is, the title of the chapter is, when should you sign your will? Yeah. So you know what is your chances of dying from a heart disease or a stroke in next 5 years, 10 years. Depending on the chances, you should sign your will. Correct? So we will learn that. And we will learn in that what are the risk factors, not only the lipid and all. And there is a lot of controversy which is happening presently related to the lipid values. Okay, AHS said this is a value, then it reduced this value, and now they are increasing this value again, the normal value. Okay, we will see that controversy also, and then I will share some statistical funny stories. Okay, how statistics is manipulated to make you believe that is good. And there was one night. In that night, what happened is Like for example, world population, 30% of world population was having hypertension. Okay. And suddenly there came one night where suddenly 50% population got hypertensive. You want to know what happened in that night? Yeah, there was some black magic or some astronomical or something. What happened? And this is the real story. Yeah, but I will tell you. So this is a separate class. Hey, Ramya, don't. Huh. So where is my file? So I realized that we cannot do lipid today. We will do two, three things. Hmm. Liver is little difficult, so we will start after warm up. Yeah. Glucose is done. Oh, we do calcium. Okay. Last time we saw TFT, thyroid function test, T3, T4, TSH, right? Close to that, there is another. Just a second. Is there some error? I'm not able to. Give me a second. Huh? I will resolve this. Last time we saw thyroid function test, T3, T4, TSH. Similar to thyroid, there is a gland near the thyroid, parathyroid gland. There are four of them. It's okay. The position, how which artery supplies they are not important. Where is they are located in the neck, thyroid, and parathyroid both. You should know this. Now, parathyroid hormone, parathyroid gland secretes parathyroid hormone. It regulates calcium metabolism. Parathyroid hormone, you don't check it routinely. You will check parathyroid hormone in a patient, two cases. One, where there are frequent kidney stones. Kidney stones frequently means the calcium is deposited excess in kidney. Calcium is excreted in the urine. And because it is excreted excess urine, it gets deposited as the stones in the kidney or the bladder or urethra, anywhere in the urinary tract. So this gives you signal that you should measure the calcium and parathyroid hormone if you have excess calcium, which is reflected in kidney disease, kidney stones or renal stones. The second can be, now here the calcium was high. Second can be calcium can be low. Okay. But now first focus on calcium high. Hypoparathyroidism is there. So we'll focus on hyperparathyroidism. Now, from where this calcium is coming? From the bones. So what is this parathyroid hormone is doing? When it is high, it is corroding the bones. It is eroding the bones. From these bones, because of the removing of calcium from the bones, the calcium in the blood is high. So what will be the another side effect of this? Another sign of parathyroid hormone high level is that it will show as osteopenia. It will show as weak bones, fragile bones. Bone density is less now because calcium is less, right? So if parathyroid hormone is high, two things will happen. First fundamental thing will happen is calcium level will be high. Because calcium level is high, it will deposit itself in kidney, renal stones. Second, because this calcium is removed from the bones, it will cause osteoporosis and weak bones, fragile bones, prone to fracture. If osteoporosis is there, weak bones are there, frequent fracture is there, renal stones are there, you will do calcium test and you will also do parathyroid hormone. Okay. Now, obviously, calcium will be high. If calcium is high, so excess calcium is rare because any excess calcium you take, it will be deposited into the bones. So excess high calcium level in the blood means most likely there is some underlying disease. Now this underlying disease means erosion of bones is happening. Calcium is removed from the bones. That is the only mechanism. If calcium is removed from the bones, there can be many reasons, 4 or 5 reasons. We should focus on one, hyperparathyroidism. In hyperparathyroid, the hyperparathyroid level will also be high. Correct? So this is the reason you will measure the calcium. Any question on this till now? Please ask questions. So for now, you should remember this, that calcium level is high in patients with renal stones. Because calcium level is high, that's why they are having renal disease. If calcium level is high, you should look for parathyroid hormone. We will see this all in detail. If you have not understood this, it is not expected for today to explain you the disease part. We will learn in the thyroid and parathyroid hormone chapter. Okay, when I will take in the class, Sunday class. Don't worry. Sorry, I wrote hyperthyroidism. It is hyperparathyroidism. For now, I just want you to know that calcium level when it is high. That's it. Okay. Now, next we will see the liver. Give me a second. Huh? Let me open the file. I will take some time to find a liver report. In the meanwhile, we'll start the kidney report, which is there in the front. So now can you see what is the interesting finding? Who will write down in this chat? This report has something which is interesting. So if blood urea nitrogen and urea, these two parameters, they are marked in bold, it means they are abnormal. But can you check the reference values? Reference values means this lab values. 9 to 23, but here it is 6. So it is low. There are many conditions where it increases. But what is it? It decreases. We'll need to find out. Okay. So here again it is low. So when you see that either it is marked in red or it is a bold, it is abnormal. But is it low or it is high? You have to check that also. And for that, you don't need to remember these values. It will be here. Which method they have used doesn't matter. For you, it's not needed to remember. Who will try to think what can be the reason for low blood urea and low blood urea nitrogen? Write down in the chat. I'm waiting for the answers. Now focus. What are the values in kidney function test? You see. Normally, you check only this first four. Blood urea nitrogen, urea, creatinine, uric acid. And this is a next level because it is a gold package. So it also has sodium, potassium, chloride, and right. Bun to creatinine ratio is inbuilt because you are measuring bun. What is bun? BUN, blood, urea, nitrogen, and you are measuring creatinine. So you can easily find out blood, urea, nitrogen divided by creatinine. So last component is always there. Okay. So in any kidney function test, you will see these five things: blood urea nitrogen, urea, creatinine, uric acid, and bun creatinine ratio. We'll see one by one what is the meaning of this. Blood urea nitrogen and urea, this should go both hand in hand. Correct? Blood urea nitrogen, when will it be high? Anywhere where there is a low volume of blood. Okay. It will be high, like dehydration, shock, burns. It will be high. It will also be high if there is some problem with the kidney. Either it can be acute renal failure or a chronic renal failure. Right? Now, acute renal failure, chronic renal failure. We will see in when we learn in those chapters what are the causes and all. But technically, being a nutritionist and dietitian, I personally believe you don't need to memorize what are the causes of acute renal failure, what are the causes of chronic renal failure. Not required. As a nutritionist and dietitian, you will see a patient and you should know, okay, this is a blood report. What is the meaning of this? And typically, patient comes with a diagnosis. What as a nutritionist I should do? What diet I should prescribe? That thing we will learn in those chapters. Low blood urea nitrogen will be seen in low protein diet, hepatic failure, or nephrotic syndrome. Okay. What is nephrotic syndrome? In short, I will tell you. So nephrotic syndrome is where the kidney loses. Normally, kidney excretes certain things and retains certain things. When the pores in when the kidney excretes more, okay, certain things which it should not excrete, you can say it is a nephrotic syndrome. So the nephrotic syndrome here in this case, you will ask the patient, do you have edema? We will see in the kidney chapter. If you're not getting it, don't worry. No need to write. Don't worry, dear. Today chapter is more about the blood report, how to read it. Okay. So as a doctor, because I'm doctor, I can tell that, okay, this patient, I will ask next question, whether you have edema, whether you have swelling around your face and all those things. If you don't have, then nephrotic syndrome is not there. Do you have a low protein diet? Okay. Are you malnourished? Right. If it is not there, then possibly we will look into hepatic failure. Hepatic means liver. Now, do you have liver cirrhosis? Do you drink alcohol? Okay, we do sonography liver now to find out. As a doctor, we are going to do. But as a nutritionist, actually, you don't need this. Okay. What you will tell to this client is, okay, you can increase your protein because you have low blood urea. When you have a renal failure, you decrease your potassium, you decrease your protein. We will see this in the kidney chapter. Don't worry. Yeah. Same is for urea. So both go hand in hand. Okay. Now, if there is blood volume is less, or diabetes is uncontrolled, or starvation is there, excess protein diet is there, kidney disease is there, then your urea will be high. Okay. Again, low urea means low protein, because protein gets broken down to urea. Then urea gets broken down to nitrogen. So that's why it is reflected. So what we are seeing is whether kidney is excreting the protein broken down protein, right? What happens to protein after it breaks down? Urea, then nitrogen. So whether kidney is optimally excreting, right? If kidney is excreting protein, what is the meaning of this? Kidney cannot excrete protein normally, right? Because the protein is a bigger molecule and the kidney has small pores. So it can excrete urea and nitrogen, smaller molecules. If it excretes protein, then two meanings. Either the diabetes is uncontrolled, very high, diabetic ketoacidosis, all those, or there is a huge kidney damage. Okay. We'll see that in the kidney chapter. Today, the chapter is about how to read your blood reports. Okay. You found it easier. Blood components, WBCs, RBCs, TFT, iron, those vitamin D, those were easier reports to read. Kidney, liver, these are complex to read. It's okay if you are not able to get it. It's okay. Creatinine, uric acid. Now, in which patients you will find uric acid very high? Before creatinine, we read uric acid. Now in MBBS, we used to have a question. Which of these parameter, kidney parameter, reflects glomerular filtration rate? What is glomerular filtration rate? Which parameter reflects? How to calculate that? Not required unless you want to become MBBS doctor. Okay. So for a nutritionist, dietitian, glomerular filtration rate, how to calculate, which molecular effects not required. Simple, I tell you. What is creatinine? Creatinine means whether your kidney is healthy or not. Simple. Whether your kidney is working normally or not. What is the function of kidney? To filter things, to excrete harmful substance, but retain good things also. Don't filter out good things. Okay. But you have to filter out harmful substance. How the RO works? You see purifier. In water purifier, there is a RO, reverse osmosis, right? So for reverse osmosis, it needs, when you install any RO, they will ask you how's your pressure in the tank. Because if you have a low pressure, then this reverse osmosis will not work. So how it works, I will tell you. There is some membrane, RO membrane. Then the good water is coming here and excreted water is coming here. This is an inlet water. Inlet water will go with high pressure in this membrane and it will get filtered out and good water will come here and harmful water will go here. Same way, this is kidney. With high pressure, with a normal pressure, optimum pressure, sufficient pressure, blood is coming, it is getting filtered, blood is going here, and harmful substance, urine, with something is coming out, creatine. Right? So, whether this RO membrane, whether your kidney is working properly, so it is measured by creatine. Easy? Right? So now if creatinine is high or low, it reflects many things. Either it is a kidney disease or there is a cardiac failure because it needs pressure, right? Because the pressure is not there in the cardiac failure, heart failure, it is going to happen. So many things. So simple one statement you should remember, one statement only. The kidney health is reflected with kidney filtration system. Kidney filtration function is reflected with creatinine. That's why you're measuring creatinine. Uric acid. So there is a condition called gout, where some patients, they have this finger joint stiffened. There is a swelling in the joints. Okay. There is a high uric acid deposition. In such patients, you will find that uric acid levels are high. Why it is there? Not in your syllabus. You can read the book, you will find out why it is there. So such patients will have high uric acid. A patient with high uric acid in urine is, then you will ask whether you have joint pains, whether you have swelling in joints, especially small joints, right? Sure. Another reason for uric acid can be high uric acid in urine, can be cancers, blood cancers, or other cancers. So if you see a patient has high uric acid, very careful. It is not a simple thing. Any of the diagnosis is going to be difficult now. This is a doctor's work now. This is an endocrinologist or maybe MD medicine doctor's work now, or maybe a cancer specialist. So don't tell the client, oh my God, you have high uric acid, there is a risk for cancer. Or you have a gout. Don't say this statement. Don't frighten the client. You tell the client the uric acid high is not good. You will need to see a MD medicine doctor now. You can no longer visit to your family doctor. You cannot visit to alternative medicine doctor. You need MD medicine doctor. He will do certain more tests and will find out what is your diagnosis. And don't take it lightly. Okay. Blood urea, nitrogen, urea, if it is high, kidney disease. Simple. Creatinine, if it is high, or then kidney disease. If it is low, then it is heart disease. Okay. Uric acid, if it is high, there may be some serious disease. So you will not find in your patients coming to uric acid high unless that patient has already a calcitosis. Okay. Sodium, potassium, chloride. Okay. So typically you will find this normal in most of your clients. Okay. Sometimes you will see sodium level high. In your practice, as a nutrition practice, you may see sodium level high. What do you think is the reason? Write down in the chat. Even if your answer is wrong, try, attempt the answer. Don't worry, give a wrong answer. So more salt intake doesn't lead to higher sodium, dear, because our body will take care of it, right? If salt intake is high, it will retain more water. And again, when you measure the sodium level of the blood, it will show normal. We will see this mechanism of salt and water in the chapter of obesity, in Sunday class of obesity. Okay. Sodium level high, you will see in certain conditions. Okay. Now, adrenal gland, dehydration, all these patients with sodium high, they are not going to come to you. They will be in ICU, right? So if you see in your nutrition dietetics practice, sodium level high, and the patient is walking, patient doesn't have apparently other problem, then you ask, how's your blood pressure? Most probably, this patient will have some problem. If you have your uh, sphygmomanometer, nowadays automatic sphygmomanometer is available for under 2000 or 3000. If you can measure the blood pressure of the client, you will easily find out. And you can do that. You don't need stethoscope. You can just press the button and done. You want to see? How many of you have not seen automated sphygmomanometer? Write in the chart. I will show you. If you want to see how to measure with that, I will show you. Okay. Potassium high, potassium low. Either it is parathyroid hormone or it is kidney disease. Chloride high, low, you will find it very, very rare. Okay. And if you do that, it is work of a nephrologist now. Typically, if you are working in a renal department, if you're going into renal ward, you will find that potassium high, chloride high, uric acid, creatinine, something high, low, all things are like that. Okay. So many people not seen. I will show you. Give me a second. I will bring it. Okay, I think I said sphygmomanometer. That's why people got confused. BP apparatus. I mean BP apparatus. When I brought it, I realized that I should have used the easier word. So have you not seen BP apparatus, dear? So the doctor chamber has a BP apparatus that pump and stethoscope and all that, right? But for home and many of the new OPDs, they will correct. So it's simple. Anyways, there are some people who might not have seen. We will correct. Seen those were okay. Those who said not seen, now they are saying seen. Yeah, it's simple. So you can buy it online, and you don't need any knowledge, anything. Simple. You put it your hand. this pipe should be down, not up, and it should be towards inner side. That is a correct position because your artery is here where you are measuring. Okay. And you tighten this. You tighten this, and it should not be too tight. It should not be loose. There should be no cloth underneath, and you should feel comfortable with this. Then there is a start button. You click on the start button. Before you do that, you should sit for 5 minutes. You should not walk and come back, right? Because it's going to be high. You should not stand and sit. You should not lie and get up. So 5 minutes, any position you be there. Okay. So either you lie or either you sit 5 minutes. You stay like that. Then you click on the start button. It will do it. Most of you have seen this. It's okay. Working. This is fairly accurate. So obviously it depends on the good brand. Yeah. So if you use a good brand, then it will have fairly accurate results. We'll say my blood pressure is always under normal to normal. Hey, but it's still high. Oh, I walked. So it's 129 and 99. A pulse is 78. Obviously, I walked and came back. So we will see it after 5 minutes again, right? So obviously, the one used in the doctor chamber, it is far more accurate, more than this, but this is also fairly accurate. It's okay, right? You are not working in ICU. Yeah, but I don't know how to do that, and I never visited back. So what is a good way is to make a diary or a piece of paper, date, time, and BP. If you want to make a journal, because we are never going to do this back button, front button, and what was my and then date, how to set the date. That's so complex. Easy is the old traditional method. On a paper, I will write down. Yeah. Uric acid decrease levels in your practice, you will rarely see. Those patients will go to specialist. Okay. Just for fun, I'm showing you the cortisol. Okay. So the question Kameshwar is asking is will be covered in hypertension chapter on Sunday class, but still I will answer this. Should low BP person take more salt? So you need to understand what is the reason of low BP. A cardiac failure patient can still have a low BP. Cardiac failure patient will have low BP, but high blood volume. If you have more salt, then heart failure will increase, will precipitate. You cannot have more salt, right? Whether it is a kidney disease, whether it is a heart disease, what is the reason of low hypertension? Or whether it is electrolyte imbalance or dehydration because you worked strenuously and a lot of sweating was there, and that's why you are having low BP. So what is the reason you need to understand? As a practice, what I do, I tell you, simple way. There are certain days when you get highly motivated to clean your house and do the things and lift weights and do all those things. Yeah. How many of you do that? On one of the time it comes, some psychotic episode, it happens. So on the psychotic episodes, you get a lot of sweat, but you are not thirsty, you are not hungry, you are not feeling sweat, you are not feeling hot. Other days you cannot go out of AC also. But on that day, so much sweating, so much electrolyte imbalance. So what I do is, as a protocol, I fill 1/2 liter bottle of Bisleri with 2 pouch of electrol. 2 pouch means these are small pouch, yeah. The bigger pouch of electrol is for 1 liter. Small pouch is for 200 ml. So 2 pouch for 500 ml. Okay. This is my 1 bottle. And my other 2 more bottles are there for Actico Pro. Yeah. So that I don't feel dehydrated while walking. Okay. It doesn't feel strenuous. After your episode is gone of heavy work, then you suddenly feel so much collapsed, right? Right. And then you have joint pain, headache, and everything, leg pains, calf muscles pain. Why? Because electrolyte imbalance has happened. You sweat a lot, electrolyte imbalance happened. Sodium has gone. So you need your electrolytes. So easiest electrolyte is electrol. The better version is fruit, salad, vegetables, right? I do that also during my cleaning episodes. Yeah. And then in the night, I don't have cramps. I don't feel exhausted. And next day, I'm still fresh. It was yesterday I did that till 11 p.m. My episode of cleaning continued. And I don't know how much I did cleaning, but finally in the morning when I saw it was only 1 shelf or 2 shelves, and still that room is dirty. So I don't know what I did. 5 o'clock to 11 p.m. So it happens, you go to that episodes. Lime water with salt, anything you can do. Salt and sugar, yes. We will see that in cardiac chapter, Gayatri. We come back to the topic, today topic. I also forgot because you was asking so many interesting questions. And out of this, I forgot what is today's topic. Blood reports. For fun, I will show you one blood report. Cortisol, right? Serum cortisol. It is mandatory that you have this sample in the morning. Okay. Before we understand cortisol hormone, no need to write. Focus here. First focus. So understand. You remember that we talked about thyroid. How it worked? There is a pituitary. It secretes thyroid stimulating hormone, which goes to thyroid. Then thyroid secretes T3 and T4. T3, T4 works on the body, and T3, T4 also goes to pituitary and says that, hey, stop thyroid stimulating hormone. Correct? If there is an excess thyroid stimulating hormone, it means because T3, T4 is less, or there is a pituitary problem. That's why it is not listening to 3T, 3,4 and secreting more. Correct? It is very rare that hypothyroidism will happen because of iodine deficiency. Everyone is using iodine salt. Yeah, it's a law, it's a rule, mandatory to sell only iodized salt. Similarly, now this was thyroid concept. Come to adrenal concept. Okay, there is adrenal gland above your kidney. What is the size? How it looks? Exactly which artery supply? Not required. Okay, forget. Adrenal glands are there, which sit above the kidney. Okay, two adrenal glands. For discussion, we focus as one adrenal gland. Yeah. Now this adrenal gland is there. It will secrete cortisol. It will work on the body. Correct. And this cortisol will also go to pituitary, and it will say that stop secreting ACTH, adrenal cortex, okay, ACTH hormone. So that don't overstimulate this. Right? Now there is a problem with pituitary, it is not listening. So it has gone rogue, it is secreting more ACTH. So that's why adrenal is secreting more cortisol. One. Second, pituitary is normal, but adrenal cortex is problem. So it is there is hyperplasia or there is some tumor. That's why cortisol is more. Or some reason is there. Okay. What is the reason? You forget. Cortisol is more. Okay. Now, this is called hyperadrenalism. Okay. There is, if it is hyper, there is going to be hypo also. So when it is hyper, what if it will secrete more cortisol? What will cortisol do? It will tell kidney, retain sodium, retain salt. If you retain sodium, it will retain salt, your body weight will increase. You will have high blood pressure. Correct? Okay. Now, and if it is retaining salt, it is retaining water, you will urinate less frequently. Now, cortisol, it is hypoadrenalism, cortisol is less. So, kidney will excrete more cortisol, more sodium and water. You will have frequent urination, you will have low BP, you will have frequent giddiness. When you get up from lying position, you will have giddiness. You will have blackening of the skin, darkening of the skin. So low cortisol level, frequent urine, low BP, giddiness, darkening of the skin. Okay. High cortisol, high BP, less urine, high sodium. Clear? When should you measure cortisol? We should know this. Okay. So typically cortisol is advised not by a local doctor. It is typically advised by endocrinologist. Technically nowadays the lab comes to your home and collects the sample and goes. So you can also advise, patient can advise, 12th pass also can advise. But cortisol level is measured when there is a suspicion that the cortisol is low or cortisol is high. Right? There are some packages which include cortisol also. This was not in the package. If you see in the report, it is not a part of the package. It was measured separately. Cortisol, when you measure, now the cortisol has there is a change. What is cortisol hormone? It is a stress. It is to manage your stress. Okay. When you are at a stress, when your body needs to preparation, your body will secrete more cortisol. You want to get up in the morning, you will have high cortisol. Then afternoon, you feel drowsy and sleepy because your cortisol is low. Then again, evening, you have to get up from your desk and run your home so that you get scolding from your wife. That's why you need preparation for that high cortisol level. Right? So there is a diurnal variation. Right? So 2 pounds typically high cortisol level in the morning and in the evening peak. So when you measure in the morning, you want to measure it before 10. Now you should not have, what are the precautions before measuring cortisol? You should tell the client, this thing you should explain the client. If a client comes to you with cortisol level, the client has already visited endocrinologist, the client has visited the MD doctor or their family doctor. No one has explained them this concept. This cortisol hormone helps you prepare for the stress, the morning stress and the evening stress to go back your home. The morning stress to go to your office. Both the stresses, it helps you prepare. So these 2 times it is expected to be high. If it is now, I don't say you have a dark skin, so you don't need to be afraid of it is low, right? You have a hypertension, okay, that maybe it is high. Let us see the report, okay? Is it high? Tell that as per this reference value, it is normal. Okay. Now, if it is high, sometimes it is marginally high. For this report, what is the reference value? 5 to 22, okay, before 10 a.m. Okay. Now, what do you think can be reason that it is high? Even if the patient doesn't have hyperadrenalism, adrenal gland is normal, pituitary is normal, but cortisol is high. Write down your reason, whatever reason. Even if it is the wrong answer, it's okay. Those who do not answer anything, they are hopeless. Those who answer something, even if they are wrong, they are trying. They will reach somewhere. Stress, not having slept in the night. Okay. Rigorous exercise. Okay. Most likely stress. Fight with your spouse in the night, fight with your spouse in the morning. Exam preparation, project submission, attending class without camera. This causes high cortisol, very high. So for all these reasons, before you measure your serum cortisol, you should have a good night's sleep. You should feel relaxed. Don't do strenuous activities. Don't do cleaning episode of your house previous night. Don't engage in fight with your spouse. And, try to relax on those days. Okay, then you measure and have a normal water and all those things. Okay, so you measure serum cortisol. So even if your level is high, there is a good possibility that your adrenal cortex is working normally, pituitary is working normally. You explain this concept to the client. Pituitary, ACTH, adrenal cortex, then it secretes cortisol. Okay, then it goes to urine. Then this cortisol goes to pituitary, says stop ACTH. Okay, so now if your cortisol is high, we have to check whether ACTH is high. Correct? Or ACTH is low. What is the thing? Okay. Okay. So you explain the client will like you that, see, they are not coming to you that, okay, ma'am, tell me how do I repair my adrenal cortex now? No, they are already taking some hormone or something they are doing. They are coming to you for something else. Or they are visited many people, but they are not find one person who they like talking, who talks and explains something well. You are not here to treat the disease. You are here to make the patient feel good. And don't forget the smile. You smile. Yeah, your diagnosis is cancer. Don't be stupid like that. So you smile and say, yeah, cortisol is high, but I will explain you what is the mechanism and all those things. I will tell you when it is high, when it is this, and what can be the normal things also, pituitary and adrenal normal, still it is high. I will tell you. Okay. So what we do, you can do it again. Okay. So I am giving you 1 week. Have complete fights, marriage counseling, read Dr. Mittal's book of marriage counseling, and then come back to me. And then we will have again cortisol level. If it is still abnormal, then we will go visit endocrinologist, we means you, and ACTH, the doctor will do. Okay. Then patient is asking, do they do biopsy and more tests and CT scan and all that? We say, not required, dear. It's okay. You're walking. You came to me by walking. Your skin is not discolored. Okay. Your skin is not pigmented. You check the BP. Okay, I will check the BP. It's absolutely okay, right? You are making the client feel good. You are building a relationship so that next time the client visits the doctor, after the doctor visits, clients come to you. Next time the client does a blood report, they go to a doctor, but they are not satisfied. They get the diagnosis, but they want explanation of that report. They come to you. Ma'am, can you explain me the report? You say yes, and you earn 1,000 rupees. Yes. So that's how you get to become a good nutritionist. So nutrition is not only, oh, cortisol patient has come, I will give him a piece of paper and put it on the paper, go. That paper goes to dustbin, nothing else. Okay, you have to talk, you have to explain. You liked it? If you liked, write down. I will follow it. If you did not like, you can still write, I did not like, up to you, no problem. Or if you still want to tear away your nutrition diet chart and give it to the client and say that, go, follow it, don't ask questions. Everything is written on this chart. Yeah. Most of the nutrition dietitian do this. Okay. When we learn building the diet plan, you will learn this concept. Okay. You will never make a tear away paper and printed chart and give it to the client and not explain. This is a average, not average, poor nutritionist. She will earn less than 10,000 rupees. How much you want to earn? Write down in the chat per month. I mean, yeah, write down in the chat. Even if your target is 10,000, 20,000, 1 lakh, 40,000, it's okay. Write down in the chat. Whatever it is. You talk to me, I will tell you the path. And I will also tell you for your profile, for what you are learning, for your attitude, for your commitment to put efforts, whether you will earn or not also. Yeah. Even if your target is 10,000, it's okay. That is the target I have. What is wrong in that? Husband is earning lakhs. Yeah. No one has done that achievement, marrying a rich husband. So you are lucky, already satisfied. No, many people have not achieved that luck, born in the rich family. You are born, your target is to earn 10,000. That is still good because you are so much busy in enjoying your life. Earning 10,000 is good target, an acceptable target. Nothing wrong with that. Don't run behind 1 lakh. Okay. Start something. Yeah. Start 10,000. Next class, you remind me the story of average. The story name is The Average. You want to hear it today? That's more of a philosophy rather than a story. It's on my channel also. Yeah. So, psychology student, those who attend those classes, they are always like, "Sir, I'm average. You are my favorite." Those who have very big aspirations, so I'm so aspirational and everything. You are not going to get a job in Domino's also. You are still a housewife. You are still unemployed. Not doing anything. Okay, you will hear that story. How many of you want to become a favorite nutritionist or dietitian? Write down. I want to become favorite nutritionist and dietitian. Complete statement. Write down in the chat. Then I will tell you story how to become favorite. Being best nutritionist dietitian, no one cares. Yeah, you are earning less. If you are favorite, you're because you are favorite of the clients. The clients will come to you. They will refer other clients. They don't need you. They don't need nutritionist. No one needs nutritionist, but they still come to you. Yeah. The people are obese. They are dying of hypertension. They are dying of disease, but they are not going to nutritionist. They are wasting 1,000 rupees for pizza and alcohol, but they are not going to nutritionist. Right. So if you're people favorite, they will come to you. Ma'am, actually, I don't need your consultation, your nutritionist or dietitian, but I got a blood report today and I want to show it to you. Not because I do not understand much, not because my doctor has not told me, but because you explain me very well, ma'am. And ma'am, you're my favorite. If client says you favorite now, it's like, oh wow, I achieved my dream. So you WhatsApp me that day. So today my client said I'm client's favorite. I'm their favorite. I will say, I'm proud of you. Very good. And if you continue to keep me informed how you're doing, I will send you some gift also. Typically, my gift is a silver coin. Yeah, a real silver, obviously, which has Ganesha and Lakshmi to as a motivation for prosperity and success. Yeah. I will tell you the story how to become favorite in your life for every this principle applies for everything. Stop writing. I will remove this. I need water first. Hey, smile. Why serious? One day, Narad Muni was having his normal stroll, Narayan, and visiting somewhere. He reaches near Narayan, Sri Narayan, Krishna, and he has a now some fun in his mind. So he asked, "Okay, so hey Narayan, who is your favorite? Who is your Priyatam?" So Narad Muni thinks for a moment and says that now this Narayana is in Krishna roop. So obviously he is going to say my Radha is my favorite, Gopis are my favorite, Yashoda is my favorite. He's so biased. But these are for this life. I have been his eternal servant. I have been his eternal devotee since the time, yeah, I am the one who is taking his name every time, every day. And I should be his favorite. So he argues. And uh, to his surprise, the Krishna says, that farmer in that village, he's my Priyatam. He's my favorite. He says, what? What? How is it possible? Not possible. Not Radha, not Yashoda, not Gopis, and not me. I'm your most, I should be your favorite. And not anyone else, but you want this. What is this? So he's like, okay. So you want to become my Priyatam? Do one thing. You take this bowl, it is filled with the oil. You do one round of the universe. The only rule is this single drop of oil should not fall. Narada Muni is very excited. Wow, this is a simple test. I can do it very easily. Yeah. And he does that. When he comes back, and Narada Muni is very excited and he says that, yes, Krishna, now I won. I'm your Priyatam. I have not dropped a single drop of oil. I passed the test. So Krishna asks, how many times you took my name? Narada Muni suddenly realized, oh no, I forgot to take your name because I was so busy in the work you gave me. So Krishna says, the work the farmer is doing is my work. I have given this work to him. See his life. He prays only one time in the morning. He takes only one name. He does not know rituals. He does not know scriptures. He does not know how to read the books. He does not know fancy things. He is not a pandit. He is not a Brahmin. He is a farmer. But he daily takes my name one time. The work which I have given him is my work. He is doing his work. He is doing my work. But he takes my name every day in his work without forgetting me. That's why he's my Priyatam. So to become the Priyatam of a client, you don't need fancy tear away sheets, or you don't need to remember the lab values. You don't need to remember many things. So don't lose your confidence in the pursuit of the knowledge. Engage the client, communicate, discuss, explain the client. Focus only on one thing, how to become Priyatam of the client. Because that is what will bring money. That is what will bring clients. They will refer more people. They will come to you even if they don't need you. They will come to you not for anything else, just for to meet. Because they want to discuss their blood reports with you. Doctor has told me everything, but I want to discuss with you, ma'am. So try to become Priyatam. Yeah. Explain the client what is the meaning of this, what is this, what is this, all these things. Wow, very good, Gayatri. So there is a platform which I sponsor, artforfun.in. I will write down here. It is mentioned in my WhatsApp profile. If you are an artist and you want to promote your artwork, you want to show it to the world, you want to promote it so that you get motivated, wow, I had done something and got a recognition, or you want to sell it, whatever is your objective, you can put it on art, get it published on artforfun.in. Yeah? Because you are my student, there is no charge for that. For others, there is a charge of 10,000 per year. And you can sell also. People are selling on this platform. Or you can just put it without value for your own sake. If someone is searching by your name, your old friend, your college friend, or your ex, or someone else is searching for you, they will find you here. Wow, you are doing good in your life. You are on Art for Fun platform, then this, that. Yeah. There are other platforms. As we go on, I will disclose to you for professional level also. If you do writing, then there's a platform, Heart to Paper. Both the platforms are mentioned in my WhatsApp profile. You can check it. It's also mentioned in my channel, hearttopaper.in. So if you do writing, poems, blogs, essays, articles, stories, you can get a publisher. If you want a book to be published out of it, I have a publication agency. You can put your fee form on Heart to Paper. We'll support you with that. Yeah. Both the places you also get recognition, awards, certificates, all those things. Yeah. To keep you motivated, to keep your passion motivated. Coming back to the blood report. So last time we did this part of red injection, pink injection, and yellow injection. Yes. Okay. So vitamin D, vitamin B12, vitamin B9. Right? So we did this story. Now, testosterone. There was one more which missed out before testosterone. What is this? Oh, so there are two testosterones. Total testosterone and testosterone free. Okay. Now understand this concept of total testosterone and free testosterone. So total testosterone means the testosterone in the blood, circulating in the blood, but most of it is attached to the blood proteins. Okay. Now, because it is attached to the blood proteins, it is not available for action. It is not acting on the cells where it wants to act. It is a free testosterone that is going to act. It is very minimum. Okay. Now, if your total testosterone is normal and you still have some symptoms, then you will check free testosterone. Free testosterone. Okay, right? So there is a reference value. For male is different, female is different. Obviously, testosterone is a male hormone, but it is going to be present in both. It is required for many things, including functions of fertility organs, then bones, all those things, metabolism, all. Okay. Now, if it is higher, then it will reflect in something. Okay. So when the testosterone is high, a female will have certain things like a male. When male has high testosterone, he will have certain things which are more. What are these more? Simple thing. Acne, sweaty, oily skin, darkening of the skin, excess hairs. Now, this acne and excess hairs, you also see in PCOD. Yeah. So don't be like, oh my God, I have high testosterone. Yes. If you are PCOD, you have hormonal imbalance. There is no doubt. Which one of which will be testosterone also little bit feature in some people. Not necessary. But measuring the total testosterone does not help you because it is a free testosterone which works in the body. Okay. For your own satisfaction, you should not measure your own testosterone level because it is costly. The number two reason is most likely it is normal. You don't need it. And endocrinologist should suggest it. Okay. So if you have oily, sweaty, smelly sweat, hairy skin, acne, you need, probably you want to measure just for measuring. And so high testosterone level will be have testosterone has two, total and free. Total does not reflect anything. Okay, it is a free. That is important. Now, if it is testosterone, you don't need to memorize the stage, values, figures, not required. Okay. You should know majorly that it is present in both. Because this is a question a client will typically ask you, ma'am, is testosterone present in female also? Yeah. So yes, in male, testosterone is secreted by testes. In female, it is secreted by adrenal cortex and ovaries. So testosterone is present in both. Obviously, female will have lower values as compared to male. Okay. Now, also explain to the client at this time, explain to the client that testosterone is, most of the testosterone is bound to some protein in the blood. So it is not available for action. It is a free testosterone that is important for the action. Okay. And that is something that needs to be measured. because most of your client will come with total testosterone. Most of the doctors, especially the family doctors, they do not know this concept, or they have forgotten this concept, or they miss out writing the free testosterone, because that is a separate test. You have seen that in the single test, it is not mentioned on the same paper, total testosterone and free testosterone. So the client had to do two separate tests for this, and that involves cost, obviously. No? So only 2% testosterone is free and available. Okay. It is increase and decrease in certain conditions. Don't worry about that so much. Okay. Because these clients are going to go to endocrinologist. As a nutritionist and dietitian, you have a limited role when such client has high or low testosterone. Endocrinology client, your food and those things will not help. There are certain lifestyle changes that will help. At this point, we will cover it, because there is no other chapter which we are going to cover testosterone. So today we will cover how, as a nutritionist, you can increase your testosterone levels. I mean, the clients. Okay. You should be able to do two things. You should be able to explain to the client that testosterone is present in both male and female, and testosterone is bound to some protein in the blood. That's why it is not available. Only 2% is available. This free testosterone is the thing which you should be measuring. This gives you real value. Now, what is the function of the testosterone? You should tell the client that it is important for fertility, metabolism, all those things, okay, bones and all those things. Excess typically will reflect. Now, if a client asks, ma'am, do you have, without doing the blood test, they have done the Google, they have diagnosed themselves, and they come to you, ma'am, do you have high testosterone? Should I do the testosterone test? You say that testosterone has two things. We explain all this, okay? This test, total testosterone is 900 rupees, free testosterone is 16 rupees. Total cost is 2,500. Do you want to do that? Instead of that, you give that money to me. I will do your consultation for next 1 month, 3 months, whatever is your fee. Yeah. So why waste your money on the test, which you don't need? I ask you a few questions. Do you have excess hair? Do you have excess sweating with bad smell? Do you have acne? Much more as compared to your age. If answers to all three is no, then you don't need testosterone test. Don't worry. You come to me. I will help you. Okay. Now, how to increase your testosterone level naturally? This question will come for a male client. Yeah. So a male client, how do you increase your testosterone naturally? Testosterone level drops if you are high stress, if your sleep pattern is affected, if you have sleep apnea, if you are not having good sleep, good quality sleep. To increase your testosterone level, what are the things you will do? I will tell you today 1, 2, 3, 4, 5 things. Have you paid the money? Yeah, 2,500, which you are going to pay to lab. You have paid me. Google GPay done. Yes. Now I will speak. Don't tell free. Otherwise, value is not there. They will not follow you. If you take the money, they will follow each and every step that you tell. So, number one important thing is you need to manage your sleep cycle. You sleep at a proper time. You wake up proper time. It doesn't matter what time you sleep, but it is important. Preferably, I tell you, if your sleep is disturbed, your 80% testosterone level is affected. But if you are sleeping at if you are sleeping late, your 20 to 30% testosterone level is affected. So what is the meaning of this? You sleep regularly, you sleep 8 hours, 10 hours, whatever is your body requires, 8 hours. Some people need 10 hours, absolutely okay. You sleep more and you sleep early. Even if you're not able to sleep early, you wake up late. Don't worry about the office, because yesterday night, what you watch in YouTube and TikTok and Instagram, that was so much important that your office is not important. So don't worry. Sleep is more important, because you need to increase your testosterone. Sleep for 8 hours, sleep on time. This will increase your testosterone level. Simple act. Now you need to observe during your sleep whether you are snoring, excessive snoring, you have a sleep apnea. That is impacting your testosterone level. Okay. Typically, male clients, middle-aged clients come with this problem, and this can be solved by simple things like this. They are afraid to go to endocrinologist, but because what they will say, they are so afraid. So they will go to a nutritionist and dietitian. So you are the best person to tell them how will you increase their testosterone level, help them increase their testosterone level. Okay. Next one is exercise. Testosterone is a male hormone. It gives you energy, passion, exercise, all those things. Yeah, strength and all. Other way around also. If you exercise, your testosterone level will increase. You will see that in your performance. You will observe that. Okay. If you tell this segment to the client, they are motivated to exercise. They are motivated to sleep on time and do their things. Okay. Any question? When someone is measuring their testosterone levels, that person either really has some symptoms or that person has performance issue if it is a male, middle-aged male. And for that person, if you say that doing these three things, doing this one thing and following my nutrition diet will help you come to your performance level, that person will be your client. And they are afraid to go to other doctors and places. Yeah, Shweta has asked a difficult question, snoring and sleep apnea. As a nutritionist and dietitian, there is a limited role for you, but still there is a role. Yeah. What is a snoring and sleep apnea? When a client sleeps, the tongue falls back, the oxygen supply is less. Yeah. Patient is not able to breathe. When there is a partial breathing, there is a snoring. Then there comes a point when suddenly the breath is cut off, and because the breath is cut off, the patient wakes up. Yeah. Suddenly the snoring stops for a few seconds, and then again the patient sleeps. Yeah. The sleep cycle is completely disturbed. Patient will be fatigued. Patient doesn't have a good quality sleep. Patient feel that they are not slept at all, even after sleeping 8 hours, 10 hours. That is a sleep apnea. That affects your emotional balance. That affects your well-being. That affects most of your hormones. Your cortisol will also be high. Stress hormones will be high. Testosterone hormone is a very delicate hormone. It gets lower. They need some exercises. They need some maybe surgery or something. That is separate part. As a nutritionist and dietitian, you can tell the client doing some exercise, a light exercise, doing pranayam, 5 minutes daily, 1 minute before you sleep. It will help you improve. Sleeping on time, reducing your alcohol or avoiding alcohol. If you increase your alcohol, notice that your sleep apnea, your snoring will increase. Avoid getting fatigued so much throughout the day that you have to crash and then you have sleep apnea. So maintain a balance. Throughout the day, if you're getting fatigued, if you have strenuous work, have some fruits, some salad, electrol, frequent water. So as a nutrition dietitian, you should tell this to the client. Don't directly jump, okay, you need to go to ENT surgeon and do a surgery. They will not do. They do not understand the seriousness. They don't want to do that. Surgery has a risk. Sleeping with sleep apnea has no risk. I am still alive. Yeah, still living. So tell the client simple things. Yes, Kameshwari. More than fertility, it affects their performance first. Okay, because for male fertility, the blockage is more common reason as compared to low testosterone. Okay, blockage in duct. Now, for low testosterone, the number one first thing they will notice is the low performance. And they do this test and then try to visit a doctor. They don't get a satisfactory answer. If you are their Priyatam, they will come to you because you explain them very well what is the meaning of this. Even though testosterone is normal, even if your performance is low, what are the things you can do to increase your testosterone level? Sleep, nutrition, right? Low stress, pranayam, visiting me when I tell you, paying my fees on time, attending the class with the video on. All these things will increase your performance. Yeah. Don't waste your money on lab tests. Don't waste your money on visiting different doctors. Don't go to alternate medicines. Instead of that, you visit me. I will tell you a real solution. Simple solution which you can follow. Now, one of the reasons for performance for these people is these are middle age. So high cholesterol. Yeah. Non-communicable diseases. Okay. So all those things, right? So we will see that in that chapter. So what will you do? You are a smart dietitian. So you will take your holistic diet plan from the heart chapter, and this you can go give to a client of a low performance. You understand? So the client has come to you asking for the what is the meaning of my testosterone report, but you have given a solution, right? You not only explained them the meaning, you told them that even if testosterone is normal, it doesn't reflect truly. You may have a low testosterone for the performance. For that, these are the reasons. For that, you need to do things which I have told you now. And now, the other reason can be because of excess lipid, cholesterol, all those things. So now, non-communicable diseases, heart, holistic diet approach. Good idea? You like this approach? So converting a client who asked you for their opinion. Excessive bailing cause snoring is not a thing actually, Ramya dear. So probably you might have seen someone who snores has excessive belly. So, but belly doesn't cause snoring. It is a fallback of the tongue because of fatigue, obesity, alcohol, excess stress, and anatomical features, some other things. Hmm. The liver we are not doing today. Huh? Any question till now? So you understood? So what a simple client of testosterone coming to you asking for a report is your client. Cortisol client is your client. A client who is sweating excessively, bad smell in the sweat, acne is your client. Okay, either you do blood tests or not, but you're explaining them the concept. You're telling them how to overcome it, right? So there is a diet for the stress. There is a holistic diet approach for the stress. We'll focus on that. Yeah. Today's the topic of the reports we are doing. Testosterone I took in depth because there is no other topic where we are going to do that again. Any question till now? Ask. Even if you have simple question, basic question, foolish question, stupid question, absolutely okay. I will answer it very sincerely. So instead of saying excess testosterone, which is a rare case, okay, excess testosterone you will see in some testis cancer and all those things. Okay, you will not see such patients. So it's but but the Ramya's question is very relevant. I tell you for nutrition practice, there are some protein powders, some bodybuilding supplements which has testosterone component in them. Okay, some bodybuilders they take testosterone. These injections, these supplements, these are very harmful. They may cause hair fall, hair loss, and this also is a temporary. Just the body is made, okay, the muscles, the build is made, but they don't have the strength. Okay, so when someone says that, yeah, this bodybuilder has taken the steroids, actually, testosterone is the name of that steroid which they have taken. Testosterone is also steroid. They have not taken cortisol. Okay, cortisol will only increase the sodium and water. If you want to increase your muscle mass, if you want to increase your bone mass, yeah, if you want to increase your body, yeah. then some people mistakenly take, wrongly take testosterone, which is wrong. It causes hair fall. Kameshwari's another question is very important, that is low testosterone responsible for azoospermia, oligospermia, and all those? Okay. It's not low testosterone is responsible for that. It's that testes are not working properly. In the testes, there are many cells. Okay. One of the cell in the testes that manufactures sperms. One cell manufactures or synthesizes testosterone. These two are separate cells, dear. But since there is a problem with the testes, if it is an overall problem, then both will be less. If there is a problem with the sperm cells, then only sperm will be less. Though the testosterone may be normal, though they may have normal facial hairs. You understand? Now, why males have beard and mustache? The facial hairs, okay? Because of testosterone, right? Now, if you see a client who has oligospermia, azoospermia, but facial hair is there, it means testosterone is normal. It means there can be two reasons. Either the duct is blocked or the cells which manufacture sperms, they are not working. But if you see a client who is oligospermia or azoospermia, azoospermia means sperms are less or zero, but no hairs on the face. There are some people, some men, even 40, 30, 20, they don't need to shave, or they shave very rarely, very patchy beard, okay, very less. Then they have low testosterone. The overall testis is working less. Then there is a condition where there is only one testis is formed. Another testis is not working. Then there is a condition when one testis is above in the abdomen. Okay. So only one testis is working. So that can be the reason for low testosterone. Low testosterone is common as compared to high testosterone. High testosterone you will see majorly in testis cancer. Madhumita is asking another interesting question. Does lack of absorption of calcium in bones show high value calcium in blood? No. You understand this. So you are not eating so much calcium. You are not eating much calcium. You are eating optimum level calcium. It is going in the blood. Now this calcium is optimum, normal level. This is supposed to be deposited in the bones with the help of vitamin D. If vitamin D is deficient, it will not be deposited in the bones. Okay. But it is not affecting your calcium level in the blood. Though it is not absorption in the bones is not happening. Correct? Now, high calcium level means where it is coming. This high calcium is not coming from your diet, not from your food, because you are not eating so much calcium. This high calcium is coming from bones. Bones are getting eroded. Osteoporosis is happening. Who is eroding the bones? Parathyroid hormone or cancer. You understand? So if your high calcium level is there, you may have parathyroidism, or a client may have some disease of the bone. Okay, because bones are eroding. So high calcium is coming from the bones, not from the diet. You understand this? Clear? Usha has asked an interesting question. When we say 8 hours sleep, it has to be continuous one, or we can split it and sleep. So I tell you what Usha does actually. Okay, what she does. Why she's asking this question? Because she has this sleep pattern. She sleeps 10 p.m. Then her husband sleeps. Then she puts alarm 1 a.m. and then she pinches the nose of her husband just for fun. Yeah, just for troubling. Then she sleeps back. That's why there is a split in her sleep. Yeah. Then 3 a.m. she puts alarm. Then she will pinch her husband. or something, and suddenly sleep, right? Just for fun, she's waking up. There is no reason that in the night you split your sleep multiple times. There is no reason for that. Yeah. So when you sleep in the night, there is no reason that you wake up and pinch someone or something and then sleep back. So unless you are doing that. So you sleep continuous. 8 hours sleep continuous. Yeah. Cat or pet at home disturbing your sleep, you should need to do some tough decisions. Training. So when I say tough decision, people are like crazy. Yeah? They start thinking something else. One day one student asked me, we'll end with this story. One time one student asked me, sir, husband is snoring very much. What should I do? Yeah. That is disturbing my sleep. That is causing me high stress. That is causing me emotional trouble. And so what should I do? I want this snoring to stop. So I said, whether you want marriage counseling answer or you want a normal answer. So if you want a marriage counseling husband, new husband. Say if you want to manage with the same husband and stop snoring, use the pillow. So everyone thought that to use the pillow, what you thought, because you are so dirty mind. Use the pillow means take the pillow, put it around your ears and avoid the noise. Yes. So put the pillow politely, press, and press it around your ears so that you will not hear the snoring. And that's how you stop the snoring with the use of the pillow. Good, enjoyed. Next class, we will see the liver, yeah, and lipid. Okay, both the things we will see, more or less related. Yeah. Usha, sleep 7 hours in the night, sleep 1 hour in the day. It depends what you want, dear. What is your requirement? Okay. So for some people, requirement is different. They want only 4 hours sleep, 6 hours sleep sufficient. And they want 1 hour sleep in the afternoon or may not want. For some people, they want one stretch sleep, 8 hours, 10 hours. Yeah. Since childhood, I sleep more. I want a longer sleep. So if I sleep at 12 or 1, I will put my alarm at 10 a.m. Yeah. If I sleep 1 a.m., I will put alarm of 11 o'clock in the morning. Because that is my requirement. If I sleep at 10, my alarm is 8. I need more sleep. Absolutely normal. And you want to divide your sleep, absolutely okay. Anything is okay. So use your pillow very carefully. Snoring will stop permanently. You will stop hearing this, getting disturbed by the snoring. I mean, okay. And see, okay, I forgot to mention that this book, the cover, You Are My Galaxy, on the marriage counseling book. This book is available on my Relate Pillar website. You can see it on my WhatsApp profile. So the painting is this, You Are My Galaxy. So the objective of marriage counseling is not to break up and divorce. The objective of marriage counseling is to give the client what they want. If they want divorce, yes, we will help you for divorce. If you want come together, we will help you with scientific relate pillar concept. There are tools. Yeah, we'll tell you. Otherwise, what happens in the market? Marriage counselors, they just do one session with the client and they tell you go for vacation. That is the only thing they know to tell. And they watch some Saas Bahu serial and from there and Big Boss and they apply these concepts. No. So there is a scientific relate concept which I have developed with the research with the help of around 100 lawyers have worked on this research. I have a law firm which works on the divorce cases and marriage counseling also. So we have developed this concept, relate pillar. There are tools in this. There are tests, 25 tests, and more than 500 couple activities. So with this, marriage counselors are now able to engage the client for 20 to 30 sessions. Earlier 1 or 2 sessions, now 20 to 30 sessions. It means earlier 2,000 rupees, now 20 to 30,000 rupees they are able to earn. And they are able to actually help the client come to the conclusion, come to the objective what they want to achieve. Either separation or want to come together. How to find out what is your problem. You can read more on the website, relatepillar.com. You can see that in my WhatsApp profile. Enjoyed? See you next Sunday. Have a great time.